Hello, dear viewers. You are seeing three different expressions on the screen. Which one would you like to see on the patient's face when he is leaving your department? Of course, the smiling and the contented one, isn't it? Which assures you of feeling better that he or she is going to get accurate results from the procedure performed, isn't it? So, to get this kind of a precious smile that is much more than anything else for your job satisfaction, what you have to do is preparing the patient. How will you prepare the patient to get this precious smile? So let us go to the topic for today, that is patient preparation for nuclear medicine procedure. The contents will be significance of patient preparation, what has to be told, technologist as an informer, and causes of patient anxiety. The significance of patient preparation. Every well-informed patient can be much more cooperative to give best results and no redos. The current awareness of the patient, because of so much of media information, chances are there of apprehension of the patient towards radioactive procedure, and the patient preparation will help much more to reduce his anxiety. The right to inform, that is, the patient has every right to get full information about whatever is going to be performed on him, and this goes as per the medical ethics. The patient care is of utmost importance and stands as an epitomic role for our healthcare professional fraternity. So, patient preparation stands out as an exhibition of this patient care, and you can show him and assure him that everything is going to be fine and okay, and he will be assured of being in right and safe hands. So, what has to be told? Why is the test being done? What is it for? How is it done? What will it tell the doctor? Will there be any pain or side effects? And how long will this test take? Everything that is printed on the informed consent before giving the signature, the patient has to be well informed about this. And if the patient does not understand or is not comprehensive, then the attender also has to accompany the patient to hear all these very clearly informed instructions. And the information as such should be given in the language known to the patient or the attender, so that there is a very clear cut information and honest and frank one. Now, the technologist, being an informer, may assume that performing the procedure is the role by itself and that his role gets ended there. But no, actually, the assistance towards satisfactory completion to get the results is what is expected from him by the management as well as the patient. So, how will you reach the patient's satisfaction? To do so, you have to listen to the patient very carefully and exclusively. There may be unique questions asked by any patient, and you have to answer that to the satisfaction of the patient, giving information, frank and honest and clear cut information without creating any extra fear, and using technical skill and showing the confidence level so that the patient feels contented and comforted about being along with you and going through this process with you. And the respecting of the patient's autonomy means that the patient, if he does not want your physical support, then you should not force him to take that one, because that may cross the limits of his own individuality or dignity towards living self-dependently. Then what about the suitability as a patient educator? Yes, the technologist stands the most suitable because he is most knowledgeable about the procedures and technical status. He can give concrete objective information to prepare the patient and minimize the patient's distress and give the right information at the right time. Now for the causes of patient's anxiety. Yes, the fear of unknown. The patient does not know the diagnosis and that creates the fear, and we should all understand this kind of situation of the patient. And the intimidating or unfamiliar environment, especially if the patient has come for the first time, it will all be so unfamiliar and not known. Even you are not known to the patient. And so you have to be very careful in dealing with the patient who has come for the first time. And the invasive procedures, if any, is not known to the patient, and if not informed well, then the patient may still stay anxious about this. That the inability to communicate effectively, if the patient cannot hear or speak properly, then or the language is a barrier, such communication barriers also can cause patient anxiety. And if at all the patient is emotionally needing some support and your space does not give any approachable look, then that also can cause the patient to become very close and not being able to ask the questions that he has inside, which is creating the anxiety. Now, patient preparation is routine for the nuclear medicine technologist, but non-routine for every patient. So make it sound, fresh, and tailor-made for each patient, and experience finally can help you to expertise. So always explain the need of certain benign and necessary practices. For example, immobilization, which should not be done rudely and without explaining the need of immobilization, and removal of precious metal objects like gold and silver ornaments should not be taken otherwise as with some kind of doubt or credibility lacking. And so you have to explain the need. So now let us summarize the points that we have seen in this presentation. Significance of patient preparation, what has to be told, the technologist as the informer, and the causes of patient anxiety. Now, as I have always been asking you the question in the last, that when I want you to do it now, taking turns, in the sense I want you to ask me any kind of question or doubt that you have, and I'll be more than happy to help you out by giving my level best of answers. So I am waiting for your questions, and if at all there is from my side, I will also try to search for the best topic for the next. Thank you.